Hey, my name is Dr. Sean Price, clinical coordinator here at The Fix. This video is very important. This video is mandatory. You have to watch this video in its entirety before we get together and do your phone consultation and report of findings. And the reason for that is because I'm going to give you the foundations of what we're going to be talking about. So for you to understand what we're talking about when we get on the phone together, you're going to need to have watched this video and have a grasp of what we're talking about. I'm so serious about the fact that you have to watch this video before we talk that I'm going to embed a secret word into this video, and I'm going to give you the letters as we go through. Before we talk on our consult, either by email or when I get on the phone with you, I'm going to ask you for this word. And if you don't know the word, then we're going to cancel the appointment and reschedule it, and you're going to have to come back and watch the video and make sure you get the word. Okay, now I'm going to give you a hint. The word is not what you think it is. So don't play Wheel of Fortune, and when you think you've got it, think you can stop the video and you're good to go. I designed it like that on purpose so that I know that you watch the entire video. Okay, so the form that we're talking about is MET 503, and you should have received that back from me by email. And what that is that's the review of the questionnaires that you sent to me and the results of that. So you need to have that form in front of you, have a pen in front of you so you can write down and take notes about what we're talking about, write down questions that may come up for you, and write down the letters for what I'm going to be giving you for the secret word. Okay, so the first letter of the secret word is the letter T. All right, it's the letter T, and I'm making note of what I've given you. So it's the letter T. So make sure you have a pen, you have a piece of paper, you have your metabolic or your MET_503 form, and you have the first letter T noted. Okay, so on this form, what we did is I took your questionnaires and I evaluated them. And based on that evaluation, there is a sliding scale. So 0 is ideal and 100 is worst case scenario. So you'll see percentages on your form. So 0% would be ideal, that organ system is functioning great, there's no problem. 100% would mean that you answered every possible question with the maximum amount of malfunction for that organ system. So 0 to 100 is a sliding scale. What we have found clinically is anything around 4 to 7% can be normal variation. So that doesn't necessarily indicate a problem in that system. Anything above 7% indicates that there is a potential problem in that system. Okay, so we're going to go through your results here, and we're going to talk about the different percentages and the different malfunctions and what they mean to you and what they mean to your body, and then we're going to establish, what we need to do for you. Okay, so before we get into this, I need to lay out what the metabolic pathway looks like. Okay, and I sent you over another form. I don't have the number on me right now, but you should have that form in front of you. Well, it's the flow chart that shows the metabolic pathway. So I want you to have that chart in front of you as well. It would be in the same email as your questionnaires. So the metabolic pathway, the way that looks, is your hypothalamus is a part of the brain that picks up on the environment. So it picks up on hormones, it picks up on the light for sleep-wake cycle, our sleep-wake cycle. It picks up on if there's bacteria present, so it controls body temperature and the fevers. Basically, it controls the body environment. One of the things that it picks up on is the level of T4 and T3. Those are thyroid hormones. So if T4 and or T3 are low, the hypothalamus releases a substance to the pituitary gland, which will also then release TSH to stimulate the thyroid gland to produce T4 and T3. Okay, so that's the basic thyroid metabolic pathway. Now it's important to understand this whole pathway because this whole pathway is what metabolism is based on. So I'm going to kind of go over it quickly in this video, and if you need more detail on it, I have a ton of videos on YouTube, a ton of videos on my website, and a ton of videos on Facebook going into this in detail. So T4 is 93% or thereabout of what the thyroid makes, and it is inactive. T3 is about 7% of what the thyroid makes, and it is active. So T3 moves on and goes into the cell for use. T4 gets onto thyroid binding globulin, goes out to the liver, to the gut, to the kidneys, and to all the other tissues in the body to convert from T4 to T3. And this back end here, this is where we get about 93% of our metabolic output. So understanding this pathway is important because as we go through your questionnaires, we're going to see where your malfunctions are happening. The other thing is that the hypothalamus and the pituitary sends a signal to your adrenal glands. Your adrenal glands release epinephrine, norepinephrine, and cortisol. And cortisol is produced from cholesterol, which converts into pregnenolone, which converts into progesterone, cortisol, DHEA, testosterone, and estrogen. Okay, so those are the basic metabolic byproducts and metabolic pathways of the body. Okay, so now what we're going to do is we're going to go through and we're going to review these with regards to your questionnaires so we know individually what is going on with you. Sorry, I'm trying to find a good marker that writes well. Okay, all right, I don't think I want to go with red. Let me get a little bit darker. It's kind of a weak black. Sorry, bear with me. No, that's an even weaker black. And there we go, got a good orange. Okay, we'll use orange. Okay, so remember, with regards to your questionnaires, 0 to 100, sliding scale, 4 to 7%, just normal variation. Anything above that's a potential issue. So the first thing that we're going to look at on your form is we're going to look at the colon. Now, the colon, that's going to be with regarding the large intestines. So basically, when you eat food, the food comes down the esophagus, goes into the stomach. The stomach, while it's there, the stomach increases hydrochloric acid, then breaks the food down. The food exits into the small intestines. The liver detoxifies your blood, stores bile into the gallbladder. When the food exits the stomach in the presence of hydrochloric acid, the gallbladder squeezes. The food comes into the small intestines, it goes through and it's digested, then it exits into the large intestines and comes out. So that's your digestive tract. So category number 1, the colon, is with regards to the large intestines. Issues there, if you're above 7% in the colon, that indicates that there are things like dysbiosis, which is good and bad bacteria being out of balance. Could be constipation, diarrhea. If it's gone on too long, it could be Crohn's disease, IBS, different things like that. Okay, so that's the colon. Category under the stomach, there are 2 numbers. So if you have above 7% in either one of those numbers, that tells me decreased hydrochloric acid. So decreased hydrochloric acid a lot of times will cause a breakdown in the digestion of the food where the food doesn't digest properly. So if you're about 30% of the patients that I work with do not have their gallbladder any longer. And part of the reason for that is because they've had decreased hydrochloric acid production for so long that when the food exits the stomach, there's not enough hydrochloric acid to stimulate that gallbladder to squeeze. So then the bile stays in the gallbladder for too long and turns into gallstones, and a lot of times patients end up losing their gallbladder. So if you still have your gallbladder, that's awesome. We'll talk about that in a second. If you don't have your gallbladder, this is probably why, because you had decreased hydrochloric acid for too long. The other thing is that if you don't have a gallbladder, you need to be on bile salts. And if you don't know what bile salts are, it is a supplement that makes up for the fact that the gallbladder is no longer squeezing the bile in there. So you need to be on those bile salts. You can contact me. I can show you how to get those if you don't already have them. Okay, so as the food, so the stomach, if you have more than 4 to 7% on that, that indicates usually decreased hydrochloric acid. Okay. Now the next number is small intestines, and if your small intestines are over 7%, then what that tells me is that as the food is coming in, it's going through, and either because of the poor digestion, because of decreased hydrochloric acid, or because of some sort of food sensitivity, you're having inflammation in the small intestines. Now, one of the problems with inflammation in the small intestines is the small intestines are made up of a bunch of different cells butted up against each other like this. So the food comes down, it gets smaller and smaller, it goes through the tight junction between these cellular walls and goes into the blood. And that's how normal digestion happens, and that's how normal assimilation happens. But if you have above 7%, 4 to 7% on that small intestine, that tells me that the small intestines are actually inflamed, and these tight junctions may actually be opening up and getting too big, allowing these bigger food particles to get in there. And a lot of times when those bigger food particles get in, they're not supposed to be there. So that causes the body to stimulate an immune response and can lead to autoimmunity. So patients with Hashimoto's disease, Graves' disease, rheumatoid arthritis, things like that, a lot of times these occur because of this leaky gut syndrome. And that's what this is, leaky gut syndrome, which occurs in the small intestines. Also, something else that can occur there is called SIBO, small intestinal bacterial overgrowth. The small intestines are not supposed to have bacteria in there. So if your colon has been out of balance for so long, or if for some reason your whole digestive system has been off for so long and you have SIBO, then that can affect the small intestines as well. So having the small intestine number being above that 4 to 7% usually leads me to know that there's at least inflammation, could be SIBO, and likely leaky gut syndrome. Okay? Now, the important thing about those first three, the colon, the stomach, and the small intestines, is that those form the gut. Okay? The gut is also responsible not just for digestion, but it's also a large portion, up to 90% of our serotonin production, which is our feel-good neurotransmitter. And it's also a large part of our immune system because of the good and the bad bacteria. So decreases in gut function can lead to decreases in immune function. So the digestive system and the gut is very, very important. Okay? If you have that on there, we have to address the digestive system and the gut. Now, that doesn't mean go out and do a gut cleanse or anything like that, because we don't know what order we need to do things in, and we don't even know if this is a causational or a side effect. But you just need to understand that there is a gut-based problem if you have these issues. Now, next is the liver and gallbladder. Again, the liver and gallbladder, that's detoxification of the blood, it's formation of bile, it's maintenance of normal blood sugar. There's a lot of things that the liver does. If you're above 4 to 7% there, again, that's 4 to 7, not 47. So if you're above 4 to 7% there, then that tells me that the liver and the gallbladder are possibly not functioning properly, and we need to look at that and address that as well. The next letter for you, remember the first letter was T, the next letter is the letter H. Okay, so we have T and we have H, so make note of that. Okay, next we're going to talk about blood sugar. Now, blood sugar, you have a normal range of blood sugar. Now, this is not based on labs. What I'm about to show you, you can have this going on for years and years and years before your labs start to show these results. So this is very important. And this blood sugar that I'm about to show you is also what we call a deal breaker. If this is going on, this has to be fixed. If it's not fixed, if you don't restore normal cellular metabolism, then your body cannot and will not heal. Okay? So normal blood sugar, when you are hungry, you're low. When you eat, you come up. So you're kind of going up and down like this. That's a normal blood sugar pathway. If you have more than 4 to 7% in the low blood sugar area, then what that tells me is when you come down, you're not stopping there, you're coming down too low. So you're having hypoglycemia. If you go to the next category and you have more than 4 to 7% in the insulin resistance, then what that means is that you're not stopping here, you're going too high. So again, even if your labs are normal, you could have one of these two things going on functionally in how you handle blood sugar. Now, if you have both, this is called dysglycemia, and this is an absolute deal breaker. This is pro-inflammatory. That means that every potential injury in your body, every bit of inflammation in your body, every joint that could possibly hurt is going to hurt worse. Inflammation also opens up the blood-brain barrier, allowing the inflammation to hit the brain, so then you start having brain symptoms. This is a metabolic stressor, which we're going to talk about the adrenal glands here in just a couple minutes. So this is very important. If this is going on, this has to be resolved, okay? Absolutely has to be resolved. So that's blood sugar. If you've got both hyper and hypo, too much, too little, low blood sugar, insulin resistance on these questionnaires, that indicates dysglycemia, and that's one of your number one priorities, okay? That's blood sugar. The next letter is the letter E. So far we have the, T-H-E. Okay, so that's the blood sugar. Now the next one is your adrenal glands. So you'll see low adrenal, but I want to go to high adrenal first, because what happens is when you have a stress response, even if it has to do with blood sugar being high, that's going to stress the adrenal glands, so they're going to cause increased cortisol. So if that happens, and then you have, it's a normal stress response, whether it's an emotional stress or a metabolic stress, but you have this stressor and you have a physical response to it and you burn off the hormones and things go back to normal, that's the way things are supposed to happen. But if you have this stressor and it stays consistently and it stays chronically and it stays for too long, you're going to start having high adrenal symptoms. So if your symptoms are above 7% on that high adrenal, that tells me that you have hyperadrenal function or chronic stress. Now, when this goes on for too long, eventually the adrenal glands start to fatigue. And when they do, these numbers, this cortisol level starts to drop. So when that happens, you start having low adrenal function. Low adrenal function tells me that you've been under so much stress, again, whether it's emotional, environmental, or physical, or metabolic, you've been under so much stress for so long that now the adrenal glands are fatiguing and your body's not able to keep up with it, okay? When this starts happening, you'll know that because your high adrenal number will be high, but your low adrenal number will be creeping up. If your low adrenal number is creeping up, that tells me that you're getting into the beginning of adrenal fatigue. If your low adrenal number is higher than your high adrenal number, that tells me that you're so far into adrenal fatigue that you've kind of passed. Because what happens is as you fatigue, the adrenal gland is going to start dropping, and the high adrenal number is going to start dropping, and the low adrenal number is going to start coming up. So when they pass each other, you know you're in heavy adrenal fatigue. Okay, so that's really important. A lot of times, blood sugar and adrenals go hand in hand. So if you have blood sugar going on, it's very likely that you're going to have adrenal stress and adrenal fatigue. Now, the other thing about adrenal fatigue is that if your cortisol levels are going low, or if they're being demanded to go high, the body, as a response, is going to start taking in these resources and start siphoning to try to get that level to where it needs to be, whether it's up high or whether it's maintaining it from being too low, because cortisol is a life-sustaining process. So the body's going to do what it has to do, so it starts siphoning these hormones up there, which throws off your progesterone, your testosterone, and your estrogen. So what we find clinically is 9 times out of 10, patients with hormone issues do not have hormone issues, they have adrenal fatigue. And when you fix the adrenal fatigue, downstream, everything else starts to resolve. So this is a very, very important disclaimer. If you start doing this work with us and you go through our program, when you do this, you will become more fertile if you're in the age of childbearing, and if you have all the parts necessary for childbearing, you will become more fertile. So please make sure you take the necessary precautions. Ideally not birth control, because that's going to throw your hormones off. But I just need to let you know to be aware of that, because we've had a lot of patients that actually are able to get pregnant that didn't think that they could. Okay, so just be aware of that. So that's the hormone imbalances. How do you know if you have hormone issues? You look down at the bottom, you'll see male hormone 1, male hormone 2, menstruating female, and menopausal female. So if any of those numbers, depending on where you fall into those categories, if any of those numbers are above 4 to 7%, then you know you have hormone function issues, which is usually related to the adrenal glands. Okay, so if you have hormone related issues, that's awesome, because when we fix the adrenal glands, a lot of times those will balance themselves out. All right, okay, so we've got all of this. The next letter in your word is F, as in Frank. So we have THEF as in Frank. Okay, so that's the adrenal glands. Now the thyroid gland, if you have high thyroid symptoms, that's a good sign. That means that you have a good functioning thyroid. The thyroid gland, when the adrenals drop and when blood sugar drops, the thyroid gland has to try to kick in to make up for that. So if you do have those high thyroid symptoms, that means that there is a good viable thyroid tissue. So even if you have a thyroid diagnosis and even if you're on Synthroid, there's a chance that there's enough thyroid there for us to work with. If you have low thyroid, if that's above the 4 to 7%, and typically most of our patients are going to have low thyroid symptoms that are pretty high, high thyroid symptoms that are either non-existent or lower than the low thyroid symptoms. But that tells me that you're having low thyroid function. Now that can be for a couple reasons. It could be actual low thyroid function, in which case we need to get in there and support the thyroid gland and try to help it rebuild. It could be because the T4 can't bind to thyroid binding globulin. Because what happens is if your hormones go out of balance and your estrogen ends up being too high compared to progesterone and testosterone, even if the estrogen is just at a normal level, but it's too high in comparison or in ratio to, Estrogen likes to bind to thyroid binding globulin and may block T4 from getting to T3, getting to that thyroid binding globulin. Now it's important to remember, T4 gets onto thyroid binding globulin to go out to these areas for conversion. So let's say that it can't get to T4 can't bind to thyroid binding globulin, then you're going to have low metabolic output and you're going to have low thyroid symptoms and you're going to appear to be low thyroid even though your thyroid is actually normal. Even if this level is normal, if there's interference in this pathway and that is lower, you're going to have low thyroid symptoms even if your labs are normal because your body is not metabolically functioning properly. The other thing that could happen is once it gets from thyroid binding globulin and gets to the liver or gut, if you have malfunction there, which you've seen based on your questionnaires, if you have malfunction in either the liver or the gut, that is 80% of the conversion of T4 to T3. So malfunction in the liver and gut will also interfere with this. So there are several places that you can have interference that could be causing low thyroid symptoms, and they may or may not have anything to do with the thyroid gland. So that's part of what we're going to be talking about when I talk to you, and we're going to go through this in detail, is figuring out where the breakdowns are happening. Okay, that's why it's so important that you understand this. So that may be a little confusing. If you need to rewind this video and go back and watch that part again, please do so because that's really important to understand. You can have low thyroid symptoms even if your TSH and even if your lab tests are normal because they're not converting on the back end and you're low back here. Okay, so it's really important to understand. And that breakdown could have to do with hormone imbalance, blocking thyroid binding globulin, which hormone imbalance has to do with the adrenal glands being fatigued, which could be due to chronic stress, whether it's physical, emotional, environmental, or metabolic, which could be related to blood sugar, which could be related to diet. So it's all intertwining. And to make it even more confusing, when blood sugar goes high and cortisol goes high, that suppresses thyroid function. So that's another way that you can have decreased thyroid function that has nothing to do with the actual thyroid. Okay? So that's really important. The next numbers on here, you'll see low pituitary and high pituitary. The pituitary gland sits right here. Normally, that's not a causation. Normally, that's a side effect of all this going on. So typically, we don't worry about the pituitary unless for some reason we get towards the end of the program and we still need some improvements. We may go in and support the pituitary. Okay, so those are your metabolic questionnaires. Now, over on the right-hand side, you'll see nerve-brain questionnaires, and you'll see a number there. Now, what that is, those are the questions that you answered that had all the yeses and nos on them. Before I get into that, your next letter is I, so we have THEFI. Okay, so make sure you make note of that I. So the nerve-brain questionnaire is, those are questions about neurological changes, brain changes. Now it's normal as we age or with stress or whatever that we're gonna have some neurological changes, but we allow for 5 yeses on that questionnaire. So you'll have a number there, and if your number is above 5, that indicates a brain-based issue. And normally that brain-based issue will happen because remember that metabolism is taking food and converting food into energy. When that energy is created, up to 30% of that fuel is consumed by the brain. So if you have poor metabolic output, if you have decreased metabolic output here, and that's going to feed the brain, then you're going to have decreased brain function, which then in turn goes back and controls metabolism, so it starts this downward spiral. So what we're working to do is by rebuilding your systems and supporting your system, we are actually going to help to rebuild this. And when you increase this metabolic output, that feeds the brain better, which then increases brain function, which then feeds into the metabolic system. So instead of going on this downward spiral, you start going in an upward spiral. Okay? So the brain aspect of this is very important. We measure that with these questionnaires as well. Okay. So those are your findings, okay? The next letter is X. So far we have THEFIX. Yes, it spells the fix, but we're not done, so don't quit. Okay, so those are your findings. Now what does this mean? This means that there are metabolic challenges. So when I get on the phone with you, you need to understand this and what's going on with your body. If you have to watch this video a couple more times to get a good grasp of this, because when we sit down on the phone, I'm not going to be able to visually go through all this with you. So I want you to make sure that you understand this. So when I sit down with you, I'm going to go through and you basically lay down, yes, you have a gut issue, yes, you have this, yes, you have that, it's affecting this, and you need to understand what I'm talking about. And I'll keep it pretty simple, but I need you to have the basics. So what we'll do is after we go through this process, then I'm going to make a recommendation to you of, do I think I can help you? If I don't think I can help you, I will give you a referral or let you know who I think you should go see next. If I do think I can help you, that means that I feel like I can design a program that's going to make a big difference for you. And the way that that works with this remote functional medicine program that we have in this remote functional medicine model is I will design a 12-week program for you. I will lay out exactly what you're going to do, what supplements you need to take, when you need to implement them, and we're going to educate you on the process. Now, this is meant to be a self-guided program. So during that 12 weeks, you'll have unlimited email access to me. You'll have a ton of videos to help coach you through the process and learn what you need to know. And then you'll have unlimited email access to me. And if you need to, which most patients don't, we try to keep this as affordable as possible. So most patients don't need this, but if you need me, you can schedule phone consultations with me. There's an extra charge for that, but I'll go through all that with you when I talk to you in your report of findings. But that's what our goal is. Our goal is for you to understand what's going on, for me to explain it to you when we talk together, and then if we decide to move forward, if you decide that this is something you want to do, I'm going to design a self-guided 12-week program for you. I'm going to deliver the whole 12-week program to you at once, so you'll always have that program. You can use it as many times as you want to. You can use it whenever you want to. I encourage you to use it for the first 12 weeks while you have the momentum going and while you have the email support. So I'll design that program for you, and then we move forward from there. Okay, so that's what your phone consult is going to consist of. I'll go over cost and pricing because it varies on the person based on the complexity of their case, what labs we might need to run. Speaking of labs, I'll go into what labs I think that we should go ahead and run with you as well, and I'll make those recommendations and give you those orders as well. So that's what we're going to do. Quick word on supplements. The supplements that we use to help support and heal this pathway is we use whole food supplements because our goal is to rebuild your body, not to stimulate the body. So it takes a little bit longer for your body to feel the benefit of these whole food supplements because we're not stimulating the body. But the long-term benefit is that as your body rebuilds, you get long-term results, and you don't need the supplements long-term because we can take those away. Okay, so I look forward to speaking to you. The last two letters are ER. So your secret word is the fixer, THEFIXER. Make sure you know that because when I call you or if you send it to me in an email, you have to know that word or we're not going to have our report of findings. We'll have to reschedule it. All right. I look forward to speaking with you and have a great day.